Okay.
Hi, welcome everyone. I hope people can hear me. This is Kathy Bouton Wilson, and I wanted to start by welcoming everyone to the webinar. Thank you all for being part of this exciting project, and I'll give you a little overview of what we are doing today. So in early 2017, a work group of permanent supportive housing providers in Chicago and Suburban Cook County convened to share information about health service models for residents in supportive housing. The purpose of the work group was to determine, through dialogue and data, whether an effective and efficient service model with shared health outcomes among PSH providers was feasible. Since then, the work group has identified and agreed on key services and related outcomes that are priorities in helping people in supportive housing to improve their health. With the assistance of HMIS staff from All Chicago and Suburban Cook County Continuum of Care, the work group created clear definitions of services and aligned those with service codes in HMIS, which we are going to talk about in a few minutes. The purpose of this webinar is to put the planning that we've worked so hard on for the past several months into practice. So again, welcome everyone. Let's just introduce ourselves. So again, this is Kathy Bouton Wilson. I am the Chief Strategy Officer of Deborah's Place and just one of the many people who worked on this project.
Hi, everybody. I'm Anna Carvlin. I'm on the HMIS team here at All Chicago, making homelessness history.
And I'm Jen Foyer-Crystal. Yeah, so I'm the Director of Housing Programs at Connections for the Homeless, and one of my roles here is supervising the permanent supportive housing program. So that's how I started working on the work group.
Erin Mazzini is with us, hopefully. She is the HMIS Specialist and System Administrator for the Alliance to End Homelessness in Suburban Cook County. So she will talk about the HMIS in relation to Suburban Cook. In the meantime, we also just want to take a minute to thank the VNA Foundation for their collaboration and support of this project, and really for pulling us all together. We really appreciate VNA and thank them for helping us so much in this collaboration. The next thing we're going to talk about is the goal of this project. So, what do we really hope to get out of this? And I think it's a goal that will benefit all of us as service providers. And sounds like we have a lot of case managers on the line. So I think hopefully that will be helpful. So while we wait for the slides to come back up, I will just share our main project goal, which is to determine effective models of health services for homeless populations being served in permanent supportive housing programs in Chicago and Suburban Cook County. So really we want to look at how we're providing health services and figure out what are the most effective ways to do it, because we're really using a lot of different approaches and a lot of different models. This data is going to be helpful, I think, to those of us who are PSH providers in our service planning, because we really want to be planning the most effective services for the people that we are trying to help, and also to funders as they determine the most effective services to fund for the various PSH populations that we serve. And I know we all serve populations that have some differences. So this will also help us to find the services that will allow us to compare service models to service models, kind of comparing apples to apples, and will allow us to use consistent language and definitions. So that's really the primary goal of this project. So the other goals that we talked about in this collaboration are to define service models that lead to the most positive outcomes. We also hope that the reports that come out of this project can really spur some conversations amongst us and help us to identify gaps in our own agencies, but also in our continuum of care. The information we also hope will be used to really ensure the best possible outcomes for the people that we serve in PSH. And finally, we're creating a collaborative community here of PSH providers who are sharing common missions and goals. We're all here for the same reasons, and this really will allow us to talk more about how we provide health services and hopefully achieve those outcomes. So as we launched into this project and really dove into it, we looked at a lot of different outcomes that we're trying to achieve. I think we probably reviewed, I can't even remember, but many outcomes. And we looked at this and thought, what are the outcomes that, first of all, are the positive outcomes that really, we believe, come out of providing healthcare services at our agencies, and outcomes where we believe, clearly link services to those outcomes. So after reviewing a lot of different outcomes, we narrowed it down and we chose 3. So in this project, we are going to define success by these 3 outcomes. And those are the outcomes listed on this slide. So this is for the purposes of this project. We're looking at, first of all, the utilization of outpatient services. So this means that we're helping, hopefully, to assist people in using outpatient services as opposed to using the emergency room and inpatient care, but really helping people use those primary care services that we believe are going to improve their health outcomes. The second outcome is housing retention. We strongly believe that having healthcare services will help people stay housed. We believe that housing is a determinant of health, so we're going to look at that. And then also access to public benefits, that when people have access to the benefits that they're entitled to, again, we hope that and we believe that will help them achieve better healthcare outcomes. So those are the 3 outcomes that we've narrowed it down to, is really ways of showing improved health for people in permanent supportive housing. So our next question, and I'm going to turn it over to Jen for this, is which services that we provide are most effective in helping people achieve these 3 outcomes?
Thanks, Kathy. So this is Jen now. So as Kathy was saying, this was kind of a natural progression because we all talked about the work we're doing, and we didn't create some new way of doing the work we're doing. This is all naturally what our agencies are doing that we believe in the end are creating better health outcomes for the participants that are living in our permanent supportive housing programs. So if you're a researchy person, you will know that kind of the stuff we're going to talk about now, that we can't make direct causal link between the services we provide and healthier human beings in our programs. But we believe that there are associations between the combination of certain services we're providing and the service models we're all using in unique and really cool ways in each program, and that they do relate to positive outcomes related to health. And some of this, as we're going to talk about in a little bit around timeline and the reports we're going to pull, some of this will be determined later. You know, we might find out that certain things really affect people's health and other things we thought did maybe don't as much. So we're going to actually walk through each outcome and which service transactions we are relating to that outcome. So I know in the city is different, and Connections is in Suburban Cook. So if you're in Suburban Cook, there are 2 agencies in Suburban Cook on the call. You know, as we talk through service transactions, some of these might be service transactions you don't have access to yet. And Erin and Anna are going to be showing us how, kind of what's going to be our array of choices once we're starting this pilot. So hang tight with that if that's making you nervous. We'll walk you through it. So let's start with the first outcome, which is linkages to non-urgent outpatient care. So you'll see a list of service transactions here. We believe that referrals to healthcare, dental care, eye care, therapy, substance use disorder referrals, and mental health referrals will help create an environment where people are using outpatient care more than inpatient. So for instance, if somebody's connected to a therapist, if they're having a mental health crisis, they're going to be reaching out to the therapist or their supportive housing case manager before they go to the ER. We also believe that some of the other services which are provided on-site, if you do have a healthcare provider on-site at your agency, you'll have the ability to click that those things are happening on site. And there is a guide attached on the right side of the screen called HMIS Errors, Terms, Codes, and Descriptions. And that will give you kind of descriptions of each code. And a lot of these are very self-explanatory. But if that link is not working, we will send it out after the webinar. And each agency will make sure you have access to that in different ways. But if that's not working for some of you, because we are having a glitch with it, we will send it back out on an email. So all of these codes that are listed is what we think, if these things are accessible and you're doing these things with people in your permanent supportive housing programs when they are requesting or need it, that will help the outcome of using non-urgent outpatient care instead of emergency or inpatient care. I don't need to call out any of these specifically, but there will be time for questions at the end if you have any questions about those. If we move on to outcome number 2, you will see some of the same codes that showed up on outcome number 1 because, as we all know, housing and health are just intricately related. So retaining your housing and linkages to non-urgent medical care, outpatient care might have some overlap. But the housing retention piece, we looked through all the work we do to help people maintain their housing. So I'm sure a lot of these are, as you're looking at them, you're like, yes, I can totally relate to how there was a crisis with somebody. We were able to mediate that crisis or de-escalate it, and that in turn helped them maintain their housing. You'll also see a lot of basic needs codes under this one. We really thought that a lot of basic needs assist people in retaining their housing because, if they have access to furniture, if they have access to, they have their ID cards, which a lot of landlords require, if their hygiene both in their unit and on their bodies is better, that helps them a lot with being able to maintain a landlord or be accepted for an apartment. So all of these relate to how we help people maintain their units. And also some of them are around increasing their income, such as money management and employment preparation. So again, if any of these seem out of whack, we can definitely talk about it in the questions section at the end. So housing retention has a whole bunch more codes related to it. And I do want to add in, because it can be overwhelming to see like 25 codes, you're not going to be putting these in thinking, how am I helping the person retain their housing? As you're putting a case note in, you're going to relate to the code that relates to that caseload, to that case note, just like you're doing now. We just want you to know where it's all fitting in the overall outcomes. So again, some of these have to do with landlord and tenant assistance, where you're mediating between landlords and tenants to make sure that they can stay in their unit. And we also included some of the referrals because, if somebody is taking care of their health, then their housing in turn is more stable. All right, so I'm going to move forward to outcome number 3, so enrollment and public benefits. This one is probably the most straightforward one, where really all the codes you're clicking around enrollment for public benefits are about the specific benefit you're helping them enroll in. So we wanted to capture both applying for benefits and maintaining benefits. So as you see, like the TANF applications, SSI applications, and then there's also general benefits assistance, where you're helping in general for them to maintain their benefits. So when you look at the errors codes definitions that are on to the right of the screen, the PDF, it'll tell you exactly when you're clicking on each of the specific codes. And we believe that enrollment in public benefits in turn make people have more opportunity to be healthy and have better well-being in their housing programs and in their lives, because they're getting access to the benefits they need, and especially health benefits. They're able to go see the doctor they need and take care of themselves. All right, and then of course, there's a couple that are related to all 3 outcomes, and those are case care management, which I know in Suburban Cook we click on that for pretty much everything we do, advocacy, and transportation. And transportation is an interesting one. We had a lot of discussion about how important it is both to drive somebody to appointments with them and to provide transportation where they go on their own through a venture card or PACE card. So that's something we really want to capture, how much we spend towards transportation, how much energy and case management time is spent actually taking people to appointments and providing access to using the bus and train system, and how much that can help with maintaining your health and well-being. All right, so now we're going to move on to the HMIS demo. So we have our IT experts, Anna and Erin, that are going to take over from here.
Sure, so this is Anna. I'm going to escape out of the slides here. So again, I'm with the All Chicago COC, and so I'll show you what that looks like on our end, and then Erin's going to walk through the Suburban. There's a slight difference because apparently some providers are not, allowed through the system to choose any service. So we have a pick list. So I'll show you that. So let's just say we're in client point, and then we go to a client, and we're going to go to service transactions. And by the way, as I'm doing this, I realize if you're ever in HMIS, chances are you probably do this already. So this is just to walk through in case you haven't done it. And also if you're a supervisor and don't get an HMIS, just to know kind of what your case managers are going to be doing with this project and in general. So in order to add a service, you're going to see your provider here and choose the correct provider in case you have multiple providers that you work in HMIS under. And then the start date, you can fill in the end date if you want to. Typically, it would just be the same. And then here's what I was talking about the pick list versus a lookup. So a pick list is preset, and we can change it by program, and we can set these very commonly used this commonly used list into your program or a customized list. Alternatively, you can look up the code in this extremely extensive, complicated errors list. And so you can see how the tree works. It's very detailed. And so, for example, we don't have meals ready to eat, but I'm just using this as an example. So for example, what we did is we listed out all of the codes that we thought were relevant to this project and their name and then the description. So really all you would need to do if you were doing the lookup would pick the exact code and then put it in here, or the exact term, and make sure you're looking up code. And so if you're not familiar, this is what it would look like. And then you can select that, and then that's the code that ends up in the list. And that's it. It's pretty basic, and that service shows up on the list. You can also, once you press save and continue, you can add notes. You can complicate it more, but we don't have all these service transactions customized completely for every provider, but we have the potential to do that. But anyway, so for the most part, once you press submit, you're done, and then you can just save and exit, and it'll show up on your list. So I'm going to go ahead and let Erin take over with the Suburban, and Erin, you should have the ability to use my mouse. Yeah, go ahead.
Okay, let's see. All right, and I just want to make sure you can still hear me.
Mm-hmm.
Okay, good. All right, so well, I'm getting in Suburban Cook. It's the system is set up for service transactions. As Anna was discussing, where we are using where we don't use the lookup until we populate the list for you for the project, and so for the agencies with the PSH projects in Suburban Cook, we will have that set up for you prior to the beginning of the data collection period, which we'll be discussing in a few minutes with the timeline. So let me go ahead and log in. Okay, so I'm going to pull up a client, and it's the process is very similar to what Anna described, at least getting to this point. And then instead of, and what I'm going to be talking about is how to record multiple services. So she discussed using a single service entry. And so for organizations that do multiple service transactions wherein you have excuse me, wherein you have services that all have the same date and timestamp on them, such as coming in at entry, the point of entry, and you're starting with case management already, and that you may be providing an additional service at that same time. So this would allow for you to record multiples all at the same time rather than doing the individual service transactions one right after another. So I'm going to, instead of clicking on the add service tile, I'm going to use the add multiple services. And same process, I'm going to select my service provider. So for the project in which I have, in your case, it's going to be the project that you have an entry, a PSH entry, and select that as your service provider. And we are set up where it autofills the start date and the end date, so that you have the same date and time stamp on the beginning and the end of the service transaction. And as Anna demonstrated, and that might be different for your project, particularly in Chicago. And so the next step with a multi-service transaction is that you click on the service type, and this is where we have all of the services preloaded for the based on what Jen just covered. So these are the standardized list of services that we all agreed upon. And so you can just select from this list, and we're going to start with case and care management, since that's the one that's most common. And then this is where you can add a secondary service transaction just by clicking on add another, and be able to pull from that list as well. And remember, if you are in Chicago, you would be using either from that list or from having that lookup function for searching through the AERS taxonomy. So we can select another service transaction. Let's do something health related. So perhaps with my client, it had been identified that it would be necessary for getting dental care. It would be an improvement for her, but you know, I'm not providing that service. My agency doesn't provide that service, but I am referring my client out for that service. And then I also have another service that I'm going to go ahead and add. Perhaps I am doing utility assistance, or something else that you would be wanting to add a dollar amount to, or notes, really depending on what your agency, let's do a utility deposit, depending on what the types of services that your agency and your project provides. And so at this point, I can click on Save and Exit. And so all of those service transactions get that same date and time stamp. And then if I wanted to go back and add more details, like Anna was talking about with notes and what have you, I just click on the pencil next to the service that that I'm wanting to update, and then you'll see those additional fields that were there with a single service transaction. And so I can add units and dollar amount, or adding funds if I have a series, a list of funding sources and so forth. And then I can just click on save and exit and have those additional details recorded.
Great. So I'll take that.
Yes.
You want to log out, Erin?
Yes, thank you.
Thanks. Cool.
Okay.
So I'm going to head back to the slides.
Okay, and this is Kathy again. I think the next thing we're going to talk about is the timeline for the project. So right now we are doing this webinar to introduce this to everyone. And then the project launch will be on July 1st. So that's when we'll actually begin collecting the data for this. In August, we will do a check-in to see how everything is going. And then the first reports, which you don't have to worry about the reports, All Chicago and Suburban Cook Alliance will be pulling these reports out of their HMIS systems. They will do that for the first time in October, and that will be the first quarter reports that will cover July, August, September. So that will give us our first chance to really look at the data and make any changes or any fixes that we might need to make. So that's it for the timeline, and I think Jen was going to do the next one.
Yeah, so we just wanted to thank all the agencies listed. There's been staff from all the agencies for over a year now coming together monthly to talk about these outcomes and how we can capture more data around health and housing. So, take a look and pat yourselves on the back for being a part of these agencies, and special thanks to everyone for jumping into this pilot. I know it's mandatory for everyone, but it's kind of a cool thing that we're doing, and I think we're going to have some really great data come out of this. And again, thank you to the VNA Foundation for kind of being the spearhead to bring us all together to talk about permanent supportive housing and health outcomes. We're going to move on now to, I don't know if I have there we go, to next steps in communication. So Kathy was saying, in 90 days, in October, at the end of October, we'll pull kind of the first quarter of the pilot data and see what's kind of coming from it. And that's going to be a really key time for us because it's going to be exciting to see kind of the first numbers. And then we want to see what outcomes data we can conclude from the service transactions and report out any interesting data to all of you. The case managers in the programs, you all are doing a lot of this work and you're putting the data in, and we want to make sure that that that's a big investment for us, and we want to know what you want from this as well. Because as managers and directors and data folks, we're excited to get all of this, but a lot of the work does fall on case managers. So we want you to let us know how we can be helpful and how this could maybe inform the work you're doing. So we kind of have three choices, and I think we're going to do a poll here and launch a poll just to ask you what you want, how you want us best to report this to you. So we gave three options, and then if there's anything that's not fitting in here, please let us know. But we thought we could do a quarterly report through email to everyone that's inputting data into the project, so you could just kind of see a summary of what we're seeing. We could have a webinar with updates on the data and outcomes quarterly or every 6 months, kind of depending on what all of you want. This is going to be a year-long project to start, so it'll go July 1st to July 1st. Or do you want to hear updates through the leadership at your agency? Okay, so it's looking like everyone's interested in getting something through a quarterly report. About 15% or 50%, I'm sorry, would like to have a webinar just where we give maybe a 15 to 20-minute update. And then some of you, half of you want to hear updates through leadership at your agency. So it sounds like there's interest in all, really the first one, of course, we're going to do, everyone wants to do. And then, we can talk about the second two and whether We just offer it, and whoever wants to opt in for a webinar, you can do that. And then we will also encourage the leadership from your agency to report and help interpret any data and like kind of what's going on with it. Thank you, everyone. This is really great feedback to hear.
So I think that's it. Any other comments from the panel?
This is Kathy. I just want to again thank everyone for participating. I think it'll be really exciting to see what kind of data we come out with, and looking forward to seeing that first report in October.
Great. Well, thank you, everybody. And you should be expecting an email coming from one of us to you or your supervisor soon with the attachment that some people weren't able to download and sort of next steps in terms of the project. So thank you very much, and I will close out the webinar.
Thank you.
Thanks so much.